Hello, my name's Emma and I'm going to show you today some acupressure points for morning sickness or nausea and vomiting of pregnancy. So I've got two main acupressure points to show you today. One is called spleen 4 and the other one is pericardium 6. So the spleen 4 is on the inner part of the foot, and I'll demonstrate how to find that in a moment. And the pericardium 6 is on the inner part of the forearm. So I'll zoom in and show you the location of the acupressure points. So at the top here we have the spleen 4 point on the inner part of the foot, where the dot and the arrow is. And then on the lower diagram we have the pericardium 6, which is on the palm side of the forearm, again where we've got the little dot and the arrow. So I'm going to demonstrate how to do the spleen 4 acupressure point first. So on the inner part of the foot, finding at the base of the big toe, the bone at the base of the big toe, and feeling down. There'll be a point that is particularly tender, and it's usually from the base of this bone, it's usually about 1 centimetre to 1 inch below. So holding the point for 30 to 60 seconds. You can hold it statically. Every now and again you can do a little movement to get into the actual point. So right now I'm feeling it right on the acupressure point. Sometimes it gets a little sharp shoot up the what we call meridian, and that's a sign that you're on the right spot. And it kind of feels like you're pushing inside a mini cup. So the acupressure points actually sort of have a little dip in them. So I'm right on the point and it's quite tender. So starting with the spleen 4, it can ground the nausea, the stomach energy down. You do need to do both sides of the foot. So you need to do your left and your right foot on the inner part of the foot where the spleen 4 is. Ooh, that one's quite tender. I've actually done a little dot on there. So once you find it, if you want to do a little dot, it can help you find it easier. But the best way to find the acupressure point is to actually go where the tender spot is after you're following the landmarks. And so the next I'm going to look at is the pericardium 6 acupressure point. So that's on the inner part of the arm. I'm going to demonstrate where it is. So there's the little forearm creases, and it's usually a couple of finger spaces below those little creases in the forearm. Again, you'll find a tender spot between the two tendons. So there's sort of a dip, there's a tendon here and there's a tendon there. In between those two tendons and below the crease, you'll find the pericardium 6. So again, holding this point for 30 to 60 seconds. Again, it might be quite tender. You can also get someone else to do it for you. Well, you just sit there and relax. Well, I guess it's not really relaxing because it's not actually a massage, but saves you holding it. The good thing about self-acupressure, though, is you can pretty much do it anywhere, anytime. And an alternative is also to use an acupressure band. A C-band is what they're often marketed as. And they are little bands with Velcro that can stick the acupressure point in the right place. So as you can see, there's a little bump in there that I call like a knobble, and that actually goes on the acupressure point, and the band is holding it in place. So I'm going to tighten this band, making sure that little bump or knobble is actually on the acupressure point, and tightening the band. And if you wish, you can also push down onto it, but in general you can just leave that band on for a long time to help you ease the nausea throughout the day. And again, obviously doing both sides, whether you're doing the acupressure point or the acupressure bands. Usually when you buy the C bands, you get 2 in the kit, so one goes on each arm. So I hope you have good luck in applying the acupressure to your acupuncture points. And a couple of other things that you could potentially do to help you ease the nausea could be some ginger tea made from ginger root. You can buy the ginger root usually at supermarkets or fruit and veg shops. And you can boil up the ginger, or you can actually cut it up and add boiling water to it and steep it for a while to get the ginger actually infused into the boiling water. And drinking it nice and warm usually is the best way. We don't recommend much more than 1 to 2 grams of ginger root per day during pregnancy, so just be mindful of that. You can also consider vitamin B6. So often if you're taking a pregnancy supplement, it often already has some B6. Or otherwise you can usually buy it just from a local pharmacy, health food shop, naturopath, or so forth. There's also flower essences and homeopathics that can be very useful. There's a selection of flower essences such as pawpaw, bottle brush, crowea, daggerhackia. They're usually ones to consider. And then in regards to homeopathics, common homeopathics that come up for nausea and vomiting of pregnancy can be sepia, colchicum, nux vomica, ipecac, and sometimes phosphorus or pulsatilla can be helpful. You do need to ensure that you get the correct remedy for you because they're specific based on specific nausea and vomiting symptoms. So you need to take a history and find out what is actually happening in the particular woman with nausea and vomiting. So perhaps she is better or worse from certain foods. Perhaps she's better from motion or worse from motion. She might have a certain emotional state, such as being more irritable or teary and weepy, or anger. So the aim is to find the one that fits the woman the most. Some women are also particularly concerned about nausea and vomiting after they've smelt certain smells, and some of them in particular are cooking smells that makes them feel nauseous. So there's certain remedies that fit that type of woman. So getting the full picture can be helpful. Good luck with all your natural therapies to help with nausea and vomiting of pregnancy. And if you need further advice, speak to your healthcare professional, your acupuncturist, naturopath, homeopath, flower essence practitioner, whatever. And if you are getting severe nausea and vomiting, there's a couple of remedies to consider that can help with that as well. And if you need to seek advice from your midwife or obstetric practitioner, then please do that as well, particularly if it's persistent or associated with symptoms that are very strong. Okay, have a good day and good luck with all your pregnancy issues and the journey.